I want to talk about the waiver, the request to change the waiver a little bit to add substance use disorder treatment for people in the state prisons and county jails to Medicaid coverage. So do we not offer anything like this currently? Do we not treat people in the prisons for substance use disorder? And if we are, how are we paying for it right now?
So Medicaid in the past has never allowed any Medicaid funding, any federal funding, to work within any of the within the incarcerated population. If somebody is in a location that is designated as a prison jail, while they're there, Medicaid is not available. That's why this waiver is such a big deal. It is being paid for by state and local funds. If there is a behavioral health program going on in any of those facilities, it's paid for by state funds. And that's really it. And there are. It's not to say there aren't programs in those facilities, but it's a lot bigger ask when it's all state general fund. So what's exciting about this is it'll be really one of the first times that this type of program will be allowed. I hope that it's the beginning, because what this will do is there'll be a time frame. Then what we're asking is there's a time frame pre-release where we know that there's going to be a transition from that facility to the community. So this begins that collaboration between Medicaid, who's a payer of those services, and the provider of the services that may be working with that incarcerated individual, and then how they transition out of that facility into the community so that care can be seamless. So those needs for a substance use service, which we know are definitely required in Kentucky. We've seen that. This is a way that we help those folks transition to the community and hopefully stay in the community.
Absolutely. We hear a lot, though, that people think that especially people with substance use disorder should be in treatment rather than incarcerated at all. So we're talking about treating people within the facilities technically. So what's your argument to those people? Is there not enough treatment beds? How is this kind of balancing out with that argument?
Oh, that's an excellent question. So we find that a lot of times folks with significant behavioral health disorders as well as substance use disorders, and I could go into a long history lesson. I will try not to, but we cut back in the 60s. We started cutting back on those community services and the institutional placements that had really significant behavioral health involvement. And a lot of times, if you're looking at behavioral health, there's a substance use component. It's really called self-medication. There's a whole piece of that. So since then, there's really not been enough funding for community services. And really those services where folks can actually access the services in the community and be supported in their community. So beginning there, right? So that's like before people get in. Making sure that we have those services available. The drug courts were a big deal that were very helpful. And so some of this waiver will hopefully address a small portion of this. But the larger piece of this is to address it in a comprehensive way. So we know we've got folks currently incarcerated who have those issues. We need to make sure that one, as they come out, we're supporting them. And then as we design more systems and more ways to divert people from going into incarceration by providing them services, that we do that. And there's some really good collaborations that are happening. We talk with the Administrative Office of the Courts all the time for help with that. Justice Noble, Secretary Noble has been a good partner there, as well as President Stivers is talking about bringing groups together to have these discussions. He's been really good about helping facilitate those discussions so that we can really address what we're seeing in our communities.
Absolutely. And I think that type of initiative is something that I think he's spoken to me about before, about wanting to do it even in 2021. Hopefully we can see something like that. But also in 2021, I want to talk about the budgetary aspects of this as well.
Right.
Because We know that corrections and Medicaid are two huge parts of our state budget, massive parts. And at first sight, this kind of looks like you're paying for both at the same time, whereas currently. But you did say we're currently using state funds for things like this. So what is the budgetary impact? You know what those kind of numbers look like at this point?
I'm going to defer a little to Lisa on this, but the fact that we're able to bring federal funds into starting to assist with that transition should hopefully ease some of the burden on those incarcerated in the facilities, which will help them, because that's always a huge challenge, because that's all general fund dollars. In terms of the overall impact of Medicaid, there will be some impact, but Medicaid's a $12-13 billion program at this point. So some of these impacts, not de minimis, but will not be so big that it should cause us any problem, particularly during this period where we have an enhanced match rate. We think that this is something that we should be able to work out. We're still working with the feds on questions and answers, and Lisa is dying to get in because I'm taking this down a funny road.
So we do have the waiver. We have been working with CMS hand in hand since we started developing the waiver. We currently have the waiver out for public comment. Comments are due November 6th. We do have to have a fiscal impact in our budget. I'm sorry I didn't bring those numbers with me, but again, the overarching issue is we want to get in there, provide services to individuals while they're incarcerated so that we have that connection when they come out. We'll also connect them with their managed care organization so that they can continue those services and hopefully decrease recidivism. The other thing that we're also doing is we're working with the Department for Juvenile Justice to try to incorporate that population into this waiver. So overall and overarching, the fiscal impact in the future should be reduced costs for the Department of Corrections, and hopefully individuals in the program will be, they'll receive treatment and they'll go on to hopefully live better lives. This is a collaboration between the Department for Medicaid Services, the Department for Behavioral Health, our Office of Inspector General, and the Department of Corrections. So we're all together in this team, and we'll be evaluating as we go forward to make sure that the results are what we anticipate.
And this is something where what we're looking to do in Medicaid in general. I remember it was some presentation somewhere, and I can't even remember where it was. But it was like, why do we pay for healthcare? And the answer is because we want to get better, right? Why do we have Medicaid in the first place? It's because we want Kentuckians to be healthier. And I, for one, am tired of the Mississippi, Alabama, and Kentucky. Even though we've moved up a little bit. We really need to impact the health of Kentuckians in ways that help them live to their full human potential. That somebody that has a substance use issue, we need to help them work through that. That's what we're supposed to do.
And I think more and more people are finally starting to come around to that idea. We've always approached addiction and recovery kind of with a 10-foot pole. Everybody was kind of like, yeah, do what you need to do, but I'm not going to get involved. I think more and more people want a stake in this fight, want to see these things addressed. And to your point about juvenile justice too, this is something that is so critical to address early. We know that it has to do with behavioral health. We know that it has to do with trauma. Interviews I've been doing lately, it starts so much earlier than I would have even anticipated. But a lot of times people end up incarcerated who have substance use disorder, don't recognize it themselves, have not been diagnosed by anyone. So who determines who's eligible for these benefits or this waiver? Who would who would qualify for this, and how do you know, especially if they come behind bars and they don't already have that, diagnosis with them?
So the individuals that'll be eligible, they have to have a primary diagnosis of a substance use disorder to be eligible to receive those services. And that would be licensed staff at the Department of Corrections who are going to be completing that assessment. So once the Department of Corrections makes the assessment, then that's when the services will begin. But they ultimately at Department of Corrections and their licensed personnel will make that determination.
Okay, and what are some of your desired outcomes from this? Because obviously we know we want more people to get treatment. We want people to not stay in prison when they don't need to be there. We want them to get the treatment they need and move on. But outside of those things, what do you see are going to be some of the biggest benefits if we are able to accomplish this with the waiver?
So we're hoping to see a decrease in recidivism, obviously. We're hoping to see an increase in compliance with substance use programs. We're hoping to see an increase in recovery and support through that recovery. Those are big pieces. What else are we hoping to see?
Improved well-being for all the members that we see. That's the overarching what we want to see. And again, every 1115 waiver has a component, a quality component to it. And we will be monitoring and watching and looking. And that's going to be the hard thing is where is their baseline and what do we see that we want to improve? That's why we have to have a collaboration with behavioral health and with Department of Corrections, because we need to at least get that baseline information to show that individuals are doing well in the community, and how do we monitor our success. So those will be reports that are forthcoming that we will definitely need to monitor and watch as we move forward.
You said we're in public comment period right now until just a couple days from now, the 6th.
Yes.
Mm-hmm.
So then when can we expect things to be final? I mean, last time we, as a state, we're all talking about a Medicaid waiver that took quite some time, as we all know, obviously more complicated and a little more convoluted than this, but when can we expect to see if this is going to be able to be accomplished and then implemented?
A lot of that will depend on CMS and when they finally approve our waiver. We will have some technology components that we need to work with. But again, we're hoping that we'll see this implemented within the next, I would say about year, next year, within the next 12 months or so.
Yeah. And yes, it always depends on CMS.
Mm-hmm.
What may be a difference here is we don't think at this point it runs afoul of basic Medicaid law. But the trick is that Medicaid in facilities. So that's probably the trickiest bit of this waiver is making sure we go through that needle in a way that stays within the bounds of existing Medicaid law.
And this is the first type of SUD waiver that has been submitted by a Medicaid agency. Mm-hmm. Other states have submitted waivers to work with for pre-trial or pre-release, for example, but nothing to this extent to actually start those services while the individuals are incarcerated and then help them move out. Yeah. So definitely first in the nation.
Right.
Which is very impressive and exciting, especially on a topic. Is there anything on this topic that we haven't covered, or things that you guys are hearing, people being concerned, especially during the public comment period, concerns that people have, or just something that you want people to know about this waiver?
I think overall we're getting a great deal of support, not only from like the health related field, but behavioral health organizations, providers themselves, even family members who believe that this is really a good plan forward to help those individuals who, like you said a few minutes ago, they don't even know they need help. So we've been hearing some positive comments, not a lot of negative feedback right now.
Yeah, I'm just hopeful, anything that we can do that will have that kind of impact that helps people maintain recovery and get through their addictions, I think is something we should all work on. This is, I think you said it earlier, so many things relate back to trauma and early trauma. And, we ask, what's wrong with you instead of what happened to you too often. And this is kind of one of those places where we do. And I think segueing into your next subject, if there's one thing that I hope COVID has taught us, and all that we've been going through is that whatever happens to one of us in a community happens to us all, and we need to be concerned about that.